Hi, my name's David Cook. I'm a professor of medicine and medical education in the Mayo Clinic College of Medicine. I'm here today to talk about my forthcoming article, Value and Process of Curbside Consultations in Clinical Practice, a Grounded Theory Study, that will appear in a forthcoming issue of the Mayo Clinic Proceedings. Curbside consultations are a common practice in clinical medicine. In a curbside consultation, one physician informally contacts another to ask advice about how to manage a patient. We know from the literature that curbside consultations are a common practice, and we wanted to learn more about how curbside consultations work and how they could be improved. To do this, we conducted focus groups with 54 physicians, internal medicine and family medicine doctors in southeastern Minnesota and western Wisconsin. In these focus groups, we learned the following 3 points. First, curbside consultations are an extremely important part of an integrated clinical practice. Physicians come up with questions on a daily basis, and everyone in our focus groups agreed that contacting an expert is a quick and practical way to get an informed answer. In fact, they felt that the back and forth conversation allowed the physician with a question to get a more personalized and more detailed answer than they might have obtained in any other way. It's also something about the patient perspective, that patients really appreciate it when their doctor goes out of their way to find an answer to their question. Second, we found that the hardest part of a curbside consultation is finding the right person to answer the question. The physician with the question might not know who to contact, or the person they want to contact might not be available. Third, curbside consultations take time. This may seem obvious, but it's important to emphasize that both the physician with the question and the physician providing the answer have to take time away from their busy practice to participate in the consultation. Physicians on both sides of the equation agree that they find the consultation worthwhile, but they really wish they could get credit for the extra effort they're putting in. Unfortunately, the current medical system doesn't reward such efforts. So how do these findings affect our clinical practice? Well, first, the cost of healthcare is a huge concern right now. Curbside consultations give us a chance to lower costs and increase value in at least 2 ways. First, the curbside allows the patient to skip a formal consultation, sparing them the hassle of returning for an appointment and also eliminating that cost from the healthcare system. Second, the curbside allows a non-specialist physician to learn and implement state-of-the-art, high-value care. We must recognize that curbside consultations are not perfect. Studies show that sometimes the doctor with a question provides incomplete or inaccurate information, and naturally this would lead to, in some instances, to inappropriate advice. There's also the issue of time, as we discussed, and also for some physicians, losing a consultation means losing some revenue. Many physicians worry about the legal risks. Fortunately, the court system thus far has protected the physicians providing the consultation. We hear a lot of talk today about medical homes. I think we should also talk about medical neighbors, our physician colleagues in the office or specialty next door who can be there to help us out when we need them. If we have a challenging patient, we can always send them to our neighbor's house, but sometimes it just makes more sense and is easier, faster, and cheaper to just have a natural conversation over the backyard fence. That's the curbside consultation. Not only does that conversation help this specific patient, but it also builds strong interpersonal relationships and builds a culture of integration and knowledge sharing. If I were a patient, I would want to receive my care at a facility where doctors talked openly about my case. So what are the next steps? There are 2 main problems with curbside consultations at the present time. First, physicians with a question need better systems to help them identify and contact the person who knows the answer. We need to figure out how to streamline this process and make it easy, fast, and accurate. Information technologies may help, but only with institutional support. Second, both the physician who initiates the consult and the physician who's offering the answer deserve credit for going the extra mile on behalf of their patient. but the current system doesn't reward this behavior, and in many ways it actually discourages it. If we really want to provide the high-value integrated care that we hope to achieve in healthcare today, this has got to change. We really must figure out how to reward physicians for their efforts. So what's the bottom line of this article? First, curbside consultations are essential to high-value integrated patient care. We can facilitate this process using information technologies and organizational change, but we need to reward physicians for seeking and sharing the information that will thus improve patient care. Thank you for your attention, and I hope you enjoyed the article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.